Please stand. I'd like for Aaron to lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Deanna, would you lead us?
I will, excuse me. I'm sorry about that. Dear Lord, we come to you this afternoon thankful for our time together, thankful for our common mission of doing good in this community and loving others the way you love us. We ask you to be with us during our time, during the work that we take on here in this community and throughout the world. Please be with those who can't be with us today, dear God, for whatever reason, and ask you just to help them to be restored to what they once were. We ask you to be with our speaker today, Dr. Bernard. We're so thankful for his leadership of our hospital and the fact that we have such an awesome facility here in our community. Please bless the food that we have enjoyed today, dear God, and pray that we'll use it to just fuel ourselves to be better. Please forgive us of our sins. In Jesus' name, amen.
Amen. Aaron has written a new song for us today. So you all know it, I know. So here we go, and we've got the words and praise. Now, let's see. We don't start with Batesville Rotary. That's the title. We start with let every good guy. I don't want you to be confused. Okay, here we go. Let every good guy raise the helmet and glove. Batesville Rotary, to carry our message of service and love. Viva la Rotary! Viva la Rotary! Viva la Rotary! Truth is our right, love is our might. Viva la Rotary! Good job!
All right. Well, I invited Aaron to lead us in the pledge because he may not know this, but tomorrow is Aaron's 1-year anniversary with the pledge. RILA applications have officially closed. We've had 4 applicants, so we're going to talk about that at the board meeting next week, but I think we have enough money to fund those students. If you're interested in sponsoring a student, however, to go to RILA, please let us know. We'd be happy for you to do that. Scholarship applications are still going through the middle of February, so if you know anyone who's a rising high school senior that wants to go to college, please tell them to apply with us so we can consider that. We've had already quite a few people apply. February 15th, that's a week from this upcoming Thursday, is the district conference in Little Rock at Presidential Library. We do have enough people for 1 table. We said we'd buy 2 tables if we had enough interest, so if you want to go, please let Amanda or me know and we'll get you down. It's a week from this Thursday in Little Rock. March 17 trap shoot tournament, I know that's coming up and Amanda will probably say some more about that. But we do need some more sponsorships for that as well, so if you know somebody or your business is interested in sponsoring a team, please let us know. Dictionaries. I have lots of dictionaries in my office. They're divided up by school. If you haven't delivered to your school yet, please let us know. And if you've forgotten, if you're on the list, I'll go ahead and get that to Amanda and we'll email it back out. But we do have quite a few dictionaries still to deliver. And I'll tell you that there's a district bike ride that we will be sponsoring in May. The district has asked to do one here in Batesville, so we're going to help them do that. Ron, you have anything on Sergeant at Arms? No, okay, nothing today. Amanda?
Okay, well, Brenda, do you want to talk about our new guest today?
Oh, I'm sorry.
Do you want to bring that up, or you want me to do it?
You can do it. You do a great job. Go ahead.
Well,
take it.
I don't want to take credit, but Brenda has reached out to Southside High School. You know, we have a couple of Batesville High School students that come every Monday, and Brenda has reached out to Southside to get some interest with them, and so they'll start coming as well. So today we have some Southside guests. So first I'll let the Batesville High School, if you guys don't care, if you all stand up and introduce yourselves and show Southside how it's done.
Just this time.
We'll go first next time.
I'm Lindley Dodd. I'm a senior at Batesville High School Student Council.
Welcome.
And I'm Abigail Kettakooten, and I'm a juniors.
Now Southside.
My name is Sydney Hunter, and I'm a senior at Southside High School.
My name is Valerie Merle, and I'm also a senior at Southside High School.
Lisa Rich.
And Lisa?
I'm the counselor at Southside High School.
Okay. Very glad you And we have a couple of other guests. Donna, do you have a guest with you, or?
No, actually, she's one of our fellow Rotarians.
Oh,
In
okay.
town, and I just met her today, so.
I bet she's the one that emailed me, and I'm blind. I don't know what I am today.
I'm Loretta Hayes. I work for AID Temporary Services, but I am a member of the Rotary in Pocahontas. So.
And we have Renee Brink with us, who's not really a guest anymore, or should not be. Renee is our district governor assistant and is here to check on us, make sure we're doing our good deeds and our good jobs, that we are doing well. And we have Kim Tucker back with us again today. Kim has submitted her application for membership, so we will bring that before the board at the board meeting next week. And so if you guys will help make her feel welcome and teach her as much as you can about Rotary, we're excited about her. So, couple other things real fast. Trap shoot, I'm going to pound that in your heads the next several weeks. I need help big time this year, guys. I'm late on getting the flyers printed out because I'm waiting on sponsorships. Right now, we only have one sponsor, and that's Johnny Kent's Firestone. So I need you guys to reach out to your businesses. I can't do it all by myself. So please help me reach out to your businesses. Find out if anybody is interested in being any of those sponsors, especially the gold and the silver, because I need to get those guys printed on those flyers. So I really need to know by the end of the week if you know of anybody that's interested in being one of those sponsors.
Amanda?
Yes.
Do we have that in print somewhere so when we go talk to them, we know what the levels are and what they cost?
The email that I sent, and I'll send it out again.
No, I'll find it.
Okay, I'm sorry, I can send it out again today.
I thought you had, I was just double checking.
Yeah, that's all that we've got right now until we get the flyers printed. Scholarships, anybody that knows any senior scholarship applications are due in by the 15th. We do have several, but I think that I've got 3 schools that have not submitted any yet. And so we really like to do one, for at least each of the 5 schools. The RI banquet is on February the 15th. We do have one table, but we'd like to send another. So if anybody is interested at all in going to that, please let me know. Matt and I think we're the only 2 that have been for the past 3 years all together. But that is a great event, guys. If you're interested, it's a lot of fun. Matt, do you want to say anything about it?
Basically, this is a fundraiser for the Rotary Foundation. It is specifically associated with the polio initiative. And what they try to do is they try to bring in a national acclaimed speaker. It is at the Clinton Presidential Library. So the venue's excellent, the food's excellent, the fellowship's excellent. You're going to meet Rotarians all over the district, and it's a great way, if you've not been at the district level participating in any way, that you can kind of see what the district's about. It usually entails a dinner, and then after the dinner you hear from a speaker that last year, I'll just tell you a little bit about the speaker. He was a leadership speaker, and specifically he talked about third world countries and his visits to those third world countries, and why the psychology of people and how they get put into situations that are undesirable. Example being, the psychology of ISIS and other things, and how you could be drawn into that from a third world country that you're given a purpose. And anyway, phenomenal job. U.S. military vet and an advocate for polio and foundations across the United States. So I look forward to this year. I think it's going to be a great event. My wife, actually, she doesn't typically like going to a lot of these functions because she's been doing it for so long and she knows kind of what to expect. But this is one that she really doesn't even hesitate when I ask her to go to every year. So anyway, sign up, you enjoy it.
Thank you, Matt. RLI is coming up again too on March the 3rd, And that is the new District Leadership Academy. That's how I met my wonderful friend Renee. And that's where I always tell you, I know you've heard me say before, that that's where I truly became a Rotarian. You learn so much about Rotary, and you know, we kind of keep Rotary here in this little bubble. We don't really see everything that's going on the outside of what our club friends are doing in their clubs. And so that's where you learn a lot about Rotary and what it really is to be a Rotarian. So if anybody is interested, I am a facilitator, Renee is a facilitator for the District Leadership Academy, and I would love to see someone from our club go. So if anybody's interested, please let me know, and you can be my riding buddy. I'm a lot of fun, I promise. Beware. Okay, I'm done. Okay, I'm done.
Deanna, do you want to say anything about service? I know we have Help and Hope on Wednesday night at 5:30, right?
Just a reminder for that would be
Okay.
good.
Good, and we have a key now. Thank the
Good
Help and Hope Board
access.
for giving us a key to Help and Hope. We will be there and be able to get in and out from here on out. So show up if you can. We'll be stuffing food packages. I don't see Ryan here in membership, but I think he was talking about doing some kind of membership drive. Audrey, cool, great job today as a door greeter. She came in and said, "I'm sorry I'm late, but welcome to Rotary." So let's get Ryan Puckett's up next week. Are there any other announcements for good of the club or community? If not, I'll invite Phil to come forward and introduce our speaker.
I'll just do it right here.
Okay.
It's my pleasure to introduce Dr. Doug Bernard. He's a graduate of Batesville High School, received his medical degree from Wayne University in Detroit, Michigan. He completed his internship at Baptist Hospital in Birmingham, Alabama. Does that make you a Roll Tide fan?
One of my kids were born down there, unless they're playing Arkansas. I've been to A&M.
In general surgery and his residency in family practice at Arkansas Health Education Center, AHAC, in South Arkansas in El Dorado, where he received honors for his outstanding resident in family practice. Bernard is board certified in family practice by the American Board of Family Practice. He's a member of the American Medical Association, the American Academy of Family Physicians, and the Arkansas Academy of Family Physicians. He joined the medical staff at the hospital here in 2000 and was appointed Chief Medical Officer in 2013. Dr. Bernard's duties include identifying solutions and assisting in developing improvements aimed at enhancing the overall environment of care. He is a facilitator and a physician advocate, improving communication between the medical staff and hospital leadership. He also serves as the director of the hospital's medicine department. The medicine department utilizes full-time physicians, APRNs, and physician assistants to direct the care of patients during their hospitalization. Dr. Bernard and his wife, Melissa, make their home in Batesville with their two sons, Garrett and Clayton. Please welcome me in joining Dr. Bernard.
Thanks, Phil. That makes me sound sort of important. I appreciate you letting me be here today. I did grow up in this town, and for those of you who don't know me, it meant a lot to me to come back to Batesville. It's a wonderful town. A lot of these people in this room were part of me growing up. I came to this when I was in high school as well. It's good to see there's still rivalry between Batesville and Southside. Continue to be civic-minded as you go through life. I've tried to do what I can when I've got the time, but this town has just meant a lot to me as far as my growth. My wife, who's not from here, back when I was a surgeon, we had a chance to go to Boca Raton to do plastic surgery, and she did not want to go. She wanted to stay in Batesville because this was a good place to raise our family. So my job at the hospital as the chief medical officer, as Phil said, is essentially I put out a lot of problems. I work as a liaison between the medical staff and the administrators. I am technically one of the administrators. I still see patients as well, along with, if the hospitalists need me to, I'm still on the trauma team. But I work on evidence-based pathways to help facilitate care so that everybody who comes through our emergency room, if you're having a heart attack, you're treated this way. Everybody does it this way, rather than Doug does it this way, Dr. Walton does it this way. that has been shown just not, even though we all may get a good result, I study what makes the results the best. And when I started off as a chief medical officer back in 2013, we were, I'm sure you've heard this story, it's a little controversial, but it's just like rating a restaurant or a motel. We were a 1-star hospital, we're now a 4-star hospital, which we've had the biggest increase in growth in the state of Arkansas as far as our quality. We've decreased our readmissions, and it's not because of me, it's because of our whole team has done a great job taking care of our patients, and I think the employees at White River Medical Center appreciate what we have there, and we want to keep people in Batesville, and we want to take care of them. We're very proud of our hospital. So I wanted to talk to you a little bit, because I get this question a lot. What happened to my doctor? Why don't they come to the hospital anymore, and what is a hospitalist? So go to the next slide, please. A hospitalist are usually physicians that are either internists or family physicians who only deal with inpatients, patients put in observation with just hospital patients. They have to be 18 years or older. In our situation at White River, they include patient care, teaching, research, and they also serve on most all of our hospital committees. They're very involved. Typically, and this is something that's fairly new, most hospitalists now don't have private practices because they're so busy doing what we have them do that they don't have time to have a private practice. And in Batesville, all of our hospitalists are employed by the hospital. None of them work outside of the hospital. Next slide, please. A brief history. The hospitalist model of care actually was developed back in San Francisco during the AIDS crisis. And the reason was a lot of these unfortunate people who developed AIDS were so sick that a group of internists, if they were in private practice, one of them would almost have to stay in the hospital all day to take care of that patient because there were so many critical changes, labs that had to be read right then, x-rays that had to be read right then, that they would stay in a hospital for 2 or 3 days or a week at a time while their partners were seeing patients in the office, and then they'd alternate that way. And so that's kind of the model of what a hospitalist does. This is something that's very commonplace in Europe. In Europe, doctors either work in the clinic or they work in the hospital. And so, as usual, we're a little bit slow to develop these kinds of practices in our country. As I mentioned, family medicine, internal medicine, and even pulmonology are typical specialties in hospital medicine. Right now, there's about 40,000 hospitals nationwide. It's the fastest growing specialty in medicine. And it's going to continue to grow over the next few years. Next slide, please. One of the concerns that a lot of us had when we first started our hospitals in Batesville were we were worried, what kind of input would I have with the administration of the hospital as a private physician when these hospitalists are driving care? Since the hospitals work for the hospital, or is the hospital administration really going to take my concerns and my patients' concerns? Are they really going to pay attention to them? And I can tell you they have. We were worried about our patients would be lost. They'd come see a hospitalist and then we'd never see them again. Some of our specialists were worried that these hospitalists are so well trained, our cardiologists wouldn't need to see them, our pulmonologists wouldn't need to see them, because that's all these folks do. And we have seen a little bit of a reduction in some of our specialty consults. One other thing that I think a lot of people were worried about, when we put a patient in the hospital, we always worried about another colleague saying, why didn't Dr. Bernard see this? He should have done this. That's never happened. So we worried that they would tell our patients something that actually wasn't happening. And all of that has proven to be, it hasn't been a problem. We haven't had to worry about that at all. Next slide, please. I'm going to briefly talk about this. I know anybody who goes to the physician has probably seen somebody typing away on the computer. I never saw a computer until 1993. It was a little Mac that I had at home. I don't know how to type. I remember writing notes on a little note card, and that was your visit in the office. And this has changed, this electronic medical record has changed a lot of physicians' lives. I know physicians, because of EMR, who will never come to the hospital again because they don't want to learn 2 different EMRs. It slows them down. I used to be able to see 50 or 60 people a day. Now you're down to 20 to 30. And so this has been very problematic for a lot of your PCPs. In the hospital, we just use one system, but if you're going back and forth, you got different passwords, different systems. It can be a challenge. Next slide, please. So why is my doctor not seeing me? Well, just time constraints. When I practiced in the hospital and I had a clinic practice, I would get there at 6:30 in the morning to see my patients, if I had 10 people in the hospital, and I'd make it back to the office by 8:30, and I had a nurse who would help me scribe on the computer to do my notes. It then became difficult because the restraints from the Affordable Care Act, there are so many different little buttons that you have to click to make your notes proper and correct so that you get paid. Every time we have to talk about smoking cessation, alcohol use, things that we would always talk about, but we may not document it. Now they want it documented, which is probably the right thing to do, but it slows folks down. And so a lot of doctors, in fact, every one of them in Batesville who used to come to the hospital, none of them come to the hospital anymore. All of the PCPs have turned over every bit of their business to the hospitals because they're so frustrated with these electronic medical records and all of the intrusive paperwork that's been laid upon them by the government. Now, I think the government's got the right idea that all these quality metrics are important, but it really has broken that bond between the patient in the clinic and the patient in the hospital, and it's really broken the spirit of some physicians. But I'm trying to make it a positive because we really try to include the PCPs and what we're doing in the hospital, and I'll talk about that in a minute. A lot of the physician burnout right now is incredibly high because of all these regulations, because of the electronic medical record. All we want to do is take care of patients, and then we find out we forgot to click a non-smoking box on somebody who's never smoked, and then we don't get paid. So it's almost set up so we don't get paid, or we on the internet, I don't have a 5-star rating as a doctor, I've got a 2-star rating because somebody didn't appreciate that I didn't get their hydrocodone filled for them a long time. And so it's a lot of doctors are having a tough time right now, but we still have good doctors who are providing great care, but it's just why we don't have a lot of docs practicing in 2 different spots. Next, please. Patient concerns. I know I heard these questions. Do the doctors in the hospital, the hospitalists, do they have access to my medical records? They do for the hospital stay. A lot of times they can't go back and look at the record in the clinic. It depends on what system. But more important, they can call your primary care doctor. So that's never been a problem. But I would tell you, if you have to go to the hospital, it's very important to have an updated list of your home medicines. That is very important because a lot of times we can't get that from the pharmacy. Sometimes we can, but if it's after hours, we can't. And so it's very important to have that list of medicines. There was also a concern about lack of communication with your PCP. Well, all of the doctors are able to log in on our hospital system. And right now I'm working on, if I can get this done, our computers at the hospital sending a daily progress note to all the PCPs. If you're in the hospital, your doctor would receive our physician's progress note every day. But they can always look up any test results. They can log into the hospital at any time, but they need to know you're there, and that's why I want to start sending this list. And then the last one, seeing a different hospitals on different days. I'll go over their schedule in a minute, but most of the time that doesn't happen. However, hospitals work 7 days on, 7 days off. So if you come in on a Friday and you don't go home until the following Tuesday, you may see a new doctor on Monday. And while they're, and that can cause some confusion for patients sometimes. Next slide, please. So, benefits of seeing a hospital. Hospitals spend their entire day in the hospital. That's all they do. They are always there. They're experts in acutely sick patients. Every one of them, I would let them take care of me. They're available on very short notice. If the hospital needed me when I was in private practice, I'd have to quit, and I did this many times, quit doing what I was doing, get in my car, drive. It might take 10, 15 minutes, and that's not much time in Batesville. But if it's an emergency, it takes a little bit of time. So these guys and gals are here all the time. They're ready to speak to the family. They're always available to speak to the patient. And they often see patients more than once a day. One of my friends, Dr. Bates, was famous for seeing people 2 and 3 times a day and on the weekends. And, the rest of my other colleagues wouldn't always do that, but the hospitals are able to do that. Next slide, please. improve efficiency of hospital care. If you're able, if I'm in the hospital and I'm waiting on a test, rather than me go back to my practice, I can get the results of that test within, as soon as it's done, rather than breaking up what I'm doing in the clinic. I can just look it up on a computer. So it makes sense that efficiency is going to be there. We can track the results, order a follow-up test a lot quicker than the folks in private practice. And actually, our hospitals, we expect them to serve as a quarterback. If you're admitted, and I have a cardiologist seeing you as well as a surgeon, we expect the hospitals to drive that patient's care to make sure everything's done, to make sure all the questions are answered, and to make sure that the care is timely. And because we don't want you waiting around for another consult. I mean, we know you don't want to be in the hospital. The longer you're in the hospital, there's more of a risk for a hospital-acquired infection. So we expect our hospitalists to be the quarterback to try to expedite care, not to run you out of the hospital, but to make sure that everything's done for what you need while you're in the hospital. And then further, we have our hospitals involved and actually lead multiple committees, which is excellent. In the past, it was just our PCPs out in the clinic drove these committees. Now that there are no PCPs or coming to the hospital, our hospitalists are involved in that, and they're involved in teaching as well. So they are actually able to drive the care and help me with some of this evidence-based research, because a lot of our hospitals are right out of medical school, or right out of residency rather, and so they're sharp cookies, all of them. And then the studies currently show that the hospital's care model reduces costs and length of stay, as well as improving quality, and that's exactly what we want. We don't want you to stay there a day longer. We don't want to spend any more money than we need to. So next slide, please. So our hospitalist program at White River has been in existence since about 2002, if I can remember correctly. It was initially designed to take care of what we call unassigned patients. An unassigned patient isn't necessarily a patient that doesn't have insurance, but just a patient who may not have insurance or may not have a primary care doctor. And so they would be admitted to one of the call groups. That became burdensome for the call groups, so the hospitalists began admitting those patients, and that's how that took off. I think we started initially with 2 hospitals, and we're currently up to 11 right now. About 2010, because of those constraints with the computer and time and quality that PCPs were finding in their office, they began approaching us about taking over their hospital practice, just getting out completely and just sticking to the clinic. And then, in fact, as late as 2 weeks ago, we finally took over the last private practice. That physician came to us and said, "I'm done. I just want to work in the clinic, and I don't want to go to the hospital anymore." So every one of the physicians in town and the surrounding communities admit their patients to our service. And so last year we had about 25,000 encounters in 2017, and that's a very that's a low estimate on that. Next slide, please. So what they're responsible for, they're responsible for all the inpatient and observation admissions to the hospital from our PCP network, and that's our entire footprint around the surrounding counties. They also admit from all of our ERs. We have 2 other ERs, one in Mountain View, one in Cherokee Village, that send patients directly to White River. They often accept transfers from UAMS, Baptist, St. Vincent's, other hospitals where families want to be here in Batesville if it's something that we can take care of. We're pretty aggressive about trying to get those folks home so they can be with families. And they're also, we charge them, they're there to respond to medical emergencies 24 hours a day. There is a hospitalist on duty in the hospital at all times. So, next slide, please. We also began teaching residents last July. For those of you who don't know, we have an accredited, through the Graduate Medical Education Commission in the United States, we have an accredited internal medicine residency. They're just about to finish their first year. The 10 residents that started last July will finish up June 30th, and then they'll start their second year, and we'll have 10 more join us July 1st. Well, our hospitalists are in charge of doing clinical teaching as well as lectures to those residents. So they've got a lot of extra work that we piled up on them last July, and then we're going to add to that, we've got a family medicine residency that's scheduled to start in July of 2019. So I can imagine that some of our hospitals will be teaching those doctors as well. We have some clinical research individuals. A couple of the hospitals have clinical research programs going on, one with the NIH. This is the only NIH hospital with this specific research project. That's pretty impressive for Batesville. I knew when I was growing up here, I didn't think we'd have a National Institute of Health grant at Batesville to study tummy problems, but we do now. And it's been going on for a couple of years, and it's pretty nice to be that one beta site. So the hospitals, like I said, are involved in a lot of committees, especially with case management, quality, and antibiotic stewardship. So next slide, please. They typically work 12-hour days, so sometimes they go home a little early, sometimes they stay late, but they work 12-hour shifts, 7 days on, 7 days off. So that's, 26 weeks a year. So they got 26 weeks of vacation a year. And I know that seems like a lot, and it is. But those 7 days are tough because you got to remember, they don't know any of these patients oftentimes when they come to the hospital. And these patients are oftentimes sick, and they demand a lot of care. It's a stressful job. But they work 7 on, 7 off. We usually, during the day, have 5 MDs from 7 a.m. to 7 p.m. plus 1 mid-level, which is a nurse practitioner or a physician assistant as part of the team. And then at night, we have 1 physician that works 7 p.m. to 7 a.m. with an RN. And that's a busy night for that one. So there's always a physician there 24 hours a day for this group. We currently have 10 board-certified internists and 1 board-certified family medicine physician. We've got 2 other physicians joining us in July. One's a family medicine physician, one's an internist. So the group is growing a bit. Next slide, please. We have 5 RNs that help take care of all the paperwork that we do, help us go see patients as well. And one of the best things, and I'll explain this in a minute, all of our providers live in Batesville. A lot of smaller hospitals, and I consider Batesville a small hospital, but a lot of smaller hospitals will contract hospitalist services out to another company, and we looked at one from Utah. And so they send hired guns in here just to work for a week, and they have no footprint in this city. And these doctors all have homes here, or they rent homes here. We see them at church, we see them at Walmart. So they're part of our community versus people that just come in, spend a week or 2 with us, and then leave. So, again, we hope. My goal is to have them come here and begin a life here. Some folks come only for 2 or 3 years. I know we're going to lose one of them in 2 years because her husband is one of our residents and he wants to go be a cardiologist, so they'll have to leave in 3 years. So we understand that, but we're really building a good base of hospitals that will stay here at Batesville now. Next slide, please. And they typically see about 15 to 20 people a day. The studies show that anywhere over 17, and sometimes the quality and the time that they get to spend with the family diminishes. I push it more towards 20. I think we're there to work hard. I think it's a different way. When I grew up, it's a different work ethic between now and the folks that are coming out of residency right now. So while they'd like to see 13 to 15, I'd like to see 17 to 20. So we have to compromise sometimes. But generally I win. But as long as the quality of care is there, I'm happy about that. So they see all the new admissions, new consults. We're always consulted by the surgeons because the surgeons are excellent at surgery. They can take out a gallbladder, but they don't know how to manage diabetes and they don't know how to manage hypertension. And just like our guys don't know how to take out gallbladders. So it's a good camaraderie. They have good communication between the two. And if we can do that quickly, if we have that open line of communication, patients get better care. They respond to all the medical emergencies on the floor, and they work with our social workers and discharge planners on the day the patient is admitted to start working on discharge planning. That's not something you want to start working on at 4 o'clock on a Friday afternoon. So, next slide, please. All right, what are we going to do? Well, I'm getting to the point with the hospitals program that you don't want to hire too many hospitals because then they don't have enough to do. But you sure don't want to run short because then you've got hospitals. These guys can go out and work anywhere they want. So we're looking at, we've got a core group that live here in Batesville that are really committed to our residency program. The hope is that they will continue to stay here. I know I've got a couple, like I said, that will probably leave us in the next 2 or 3 years. We've got 2 more joining us this summer, but we're also looking at how can we utilize nurse practitioners and physician's assistants to help us. You know, we work well with it. People wonder what kind of responsibilities they have. Well, the 2 mid-levels that we have on our team all have to answer to us. They can go see a patient, they can write orders, but once they do, we sit down with them every day and review what they did with that patient. Because our patients, we try not to, we don't give them the sickest patients, we give them the simplest patients. But they still have a lot of oversight from the physician. And I know I've had complaints in the hospital about, I only saw a nurse practitioner, I really want to see a doctor. And that is your right. If you're in the hospital and you want to just see a doctor, that's fine. And we will make those arrangements. I think if you got to know our nurse practitioner and our physician assistants, we've got a couple good ones. And over time, I think you'd see that they do a pretty good job. But this is a new culture, and you know, it's cheaper to use nurse practitioners and physician assistants than hiring 2 new physicians. But even though it's cheaper, you have to make sure that they can provide that quality of care. So there's a fine balance there. So we're going to continue to grow the hospitals program. We've had some questions about what about OB. You know, I know St. Bernard's, they use what's called a laborist. That's a physician that just takes call at nighttime and lets the OB doctors sleep, and they're in charge of all the deliveries overnight. So if Dr. Jones has a delivery at night and he's not on call, the laborist takes care of it. And then we've had the same thing with the pediatrician, you know, so if there's a pediatric admission. So these are all things we have to look at. I don't know that we have enough pediatric admissions at night to justify that, but we may with a laborist. But I can tell you right now, our obstetricians don't want that. They'd rather take their own call. They told us they didn't get into this to let somebody else deliver their babies. So that's kind of how they feel right now, and we'll see how that goes in the future. So surgicalists the same way, and that's just a surgeon that takes overnight surgery call and can operate and let our guys get some rest. So that's my last slide. I will be glad to answer any questions about the flu, the hospital, anything. Mr. Kemp.
At any one moment in time, how many of the beds in the hospital are occupied?
At any one moment.
Well, I mean, how many people can you accommodate as far as admission?
220.
220, okay.
220, yeah, and that includes, I mean, we have a senior psychiatric section as well as an adult psychiatric section. Then we have some observation beds and then acute care beds, but 220. Yes, sir. Something else?
With the hospital taking over more private physicians' practices, do you see the problem with the primary care physician electronic medical records and the hospital electronic medical records? Do you see that disconnect going away in the future?
You know, I'm hoping, because here we've tried to, a lot of this has happened so quick. We're using outside of the hospital, a company called Athena. And Meditech, what we use inside the hospital, can allegedly talk to Athena. And a lot of our practices are already on Athena. There's a few of the practices that were just bought up in the past 2 years that were so big that it's going to be a pretty significant capital investment, and we have to get the doctors to want to learn how to use a new EMR and convince them to do so that we can put Athena there. But then there's supposed to be some interface that those two can talk, because that way we can pull that data in and they can also see what we're doing. They can always see what we do, but they have to have the time in the day to go to the computer, quit doing what they're doing.
They have to use a different system.
They have to use a different system, and that's tough to do sometimes. Any other questions? Yes, sir.
What's the largest bureaucratic or regulation that you'd like to see lifted to be more efficient?
I can't stand electronic medical records. I know they're good. I know they've got some qualities, but I can tell you that, and they're not going away. I just don't think we are as efficient, and I don't think it's patient friendly, and I'll tell you why. I hate sitting in a room typing on a computer with my back towards a patient, or even looking down. Number one, I can't type, but if I could type, typing while I'm looking at a computer rather than looking at a patient, I can't imagine anything so cold if I was going to a physician's office. But that's not going to go away. I think some of our quality metrics, why do I continue to have to ask somebody about safe sex, smoking, alcohol use when my patients administer? And if I don't ask, there's always these gotcha things with Medicare. If you don't do this, we're not going to pay you. And they do this in the hospital as well, but the same thing in the clinics. And I'd love to see some of those onerous regulations go away. I think doctors were doing a pretty good job. We need to do better. We need to not worry about volume-driven businesses. We need to work. I think quality-driven reimbursement is the most important thing. That's what you pay for. Not just how many patients can I see a day, but how well did I treat you? And I think I'm looking forward to us changing to that. That's what we should have been doing all along. But if we could get rid of the computers, it would be great. That's not going to happen.
Thank you, Dr. Bernard.
You're welcome. You're welcome.
Let's give him a hand. You may know this or may not, but we will donate a book in your honor pursuant to our literacy project. Talk to the Hand. Someone donated today. So
I've heard that before.
if you would like to pick our winning Joker draw ticket,
Might be lucky and they might do that. All right. 231-8236. 8236.
Somebody else.
All right. Okay. You get to draw from the deck of cards. If you win the Joker card,
If you win, you know you'll
And
be
you
written
better run.
down on a race. What a friendly club we have.
yeah, you might need to step first.
Don't draw, you might want to head for the door.
We wish you all the luck. She didn't get to do it.
Thank you.
That's your souvenir.
we're glad to have you visiting with us. Any other announcements for your club or community? All right, well, as we always do, it's a four-way test. Number one.
Is it the truth?
Number two.
Is it fair to all concerned?
Number three.
Will it build goodwill and better friendships?
And number four.
Will it be beneficial to all concerned?
Have a great week.